absolutely. So, you're taping now? Okay, perfect.
Mm-hmm.
So that type of cough we call a collapsing trachea cough. So there's two main parts to your respiratory tract. There's the upper respiratory tract. That's going to be like your voice box up here, and it's going to be your windpipe that goes right down here. And then that splits into two big branches called your main stem bronchi right in your chest. The lower respiratory tract is your lungs. Her cough sounds to me like it's from a collapsing trachea. Collapsing trachea is very common. She's not even the first Pomeranian that I've seen today with this problem. She's the second Pomeranian I've seen today with this problem. It is one of the most common diseases that we see.
So it's not that serious?
It's not that serious. It is progressive, and that's where the seriousness comes
It doesn't
in.
require some kind of an operation?
Not
or
an
something?
operation. Nope. We use a little bit of very simple medication at home to help control the cough.
Oh,
So
thank
it's-
God, Foxy.
Yeah, good girl. So I know. You see somebody?
Yeah, I know. She's my guard dog.
She is protecting you.
Yeah, okay.
So, basically, what this disease is that we think that these dogs, Yorkies, Pomeranians, a lot of these small breed dogs are born with a predisposition for this to happen. So we've got these rings on our windpipe or trachea. You can actually feel yours over here. They're these rings made of cartilage, and they're supposed to be nice and firm and wide open. But these dogs are born with rings that are softer, okay? And so instead of staying wide open like an airway should be, they're prone to doing this and this and this. And that's what we call collapsing trachea. So when your airway gets narrower like that, you cough because you feel like there's something in the way. So you cough, and it increases pressure inside your airway, and it makes it collapse more. So then you cough more, and then it collapses more, and then you cough more. And so in addition to that, you also...
Come on, baby. Come on.
You're okay. I love you.
She's sweet people.
In addition to the worsening and worsening collapse as you cough, you also get inflammation on the inside of your trachea, and that makes the inside even narrower, so they feel like they've got even less airway. And so it is a disease that tends to stay pretty localized. It usually just affects that main trachea or windpipe, and then those two branches, the main stem bronchi. In terms of making a definitive diagnosis, we could do that in a few ways. The first is we might not have to make a definitive diagnosis. She's the right breed, she has the right history. If you want, we could just go ahead and start treating from here. And if she doesn't respond to treatment, then we could take a step back and make sure we've got the right diagnosis.
Okay.
Another thing that we could do today is to take x-rays of her chest. X-rays of her chest don't always show the tracheal collapse because sometimes, especially when it's fairly mild, it might only collapse when she's coughing. And so you can have a normal x-ray if it's taken when she's not coughing.
Well, what do you think about the x-ray we have?
I didn't see it on the x-ray but it was from 1.5 years ago. And as I said, a normal x-ray by no means does that rule out collapsing trachea. What's nice about an x-ray is that it can help us rule out other causes of cough, like an enlarged heart or lung problems. So we could do the x-ray today, we could skip the x-ray today. You know, I feel...
Well, I have a copy of the x-ray if you want to take a look at it.
No, I have it.
Oh, yes, yes.
But it was from 1.5 years ago. So
but based on that, can you tell me what's wrong with that?
I didn't see a collapsing trachea on that x-ray. But again, it's 1.5 years later, so, things could change.
Yeah.
So we could do an x-ray today, or we could do an x-ray if the signs progress or don't respond to medical management, whatever you want. In terms of medical management, we use about 3 or 4 medications, not always all at the same time, but there's about 3 or 4 medications that we use to help with this disease. The first medication that we use that we find that's really helpful because a lot of these dogs cough with excitement. So we use an anti-anxiety medication called trazodone that just takes the edge off a little, that makes them not get so excited when the doorbell rings or when somebody comes to deliver the mail, that sort of stuff.
Isn't that natural with Pomeranian? They're so...
Yeah, exactly. We
call them barkaholic.
Yeah, exactly. So we usually recommend using that medication twice a day if you think that there's an excitement component.
What's the downside of that medication? It's not like prednisone?
No. It's sedation, and if she's sedated, then we can give a lower dose.
Oh, okay.
Yeah, so it's pretty simple medication. I have a lot of patients on it. All of our dogs with collapsing trachea are on it. The other medication that we use is a cough suppressant, because what we want to do is we want to try to break the cough cycle, because every time she coughs, the trachea collapses more, and then it causes her to cough more, and then the trachea collapses more. So we try to break the cough cycle with a cough suppressant. We do recommend using the cough suppressant. Some people will just use it as needed when the dog is coughing, but we like to use it at least twice a day, every day, so that we can...
For how long?
Well, potentially forever, and we'll talk about what's the long term with this disease. I do have some clients whose dogs have a mild tracheal collapse, and we're able to use these medications maybe for 2 months, and then the trachea is feeling a little bit better and we're able to stop the medication. But the important thing to know about this disease is it's progressive. I'm not going to return that trachea to normal. She's always going to have this disease. And the medications can help it progress more slowly. It may be that we could get it to progress slowly enough that she never gets any worse than this, but a lot of dogs do.
So if she keeps taking this cough medicine like for prolonged period of time, it's not going to damage her organs?
No, it doesn't damage organs. The main side effects of the cough suppressant, which is called Hycodan, is sometimes if you're using a lot of it, you'll get, again, sedation, or sometimes it can cause some constipation. It's an opioid, and so you see a lot of people will use opioids for cough or for pain, and they'll get constipated too. Yeah. The small dose that we're going to recommend for her, I don't think you'll see any side effects. But for example,
is it good if she eats like fruits? Or dogs shouldn't eat fruits?
You can stay away from grapes and raisins. They're poisonous for dogs. You can do a little bit of fiber with her diet, maybe a little mango or something or watermelon or something like that.
I give her some apples when I cut apples in the morning.
Absolutely.
I have apples and carrot juice in the morning.
So carrot is fine.
I cut some of that for her, and she plays with blueberries, and I don't know if that's not poisonous.
No, not poisonous. They do have a lot of fiber too.
Good, sounds good.
So the trazodone and the Hycodan are medications that we do recommend giving regularly. On top of that, sometimes if we think that there could be like a secondary bacterial infection, we might do a short course of antibiotics.
Oh, antibiotics, okay.
And then sometimes...
I think she did have some.
Yeah. And then sometimes if they're having a bad flare-up or something like that, we'll do a short course of steroids, but we do it usually just for a brief period of time on top of the other medications.
Okay, well, she just had that this year, so,
so
maybe we don't want to do that again.
That's totally fine. No, that's totally fine. In terms of the two medications, the anti-anxiety medication and the cough suppressant, they don't, we don't require that you check blood work prior to starting them. They don't really have effects on kidney, liver, those sorts of things. However, if she hasn't had blood work in a while, that's certainly something that I could offer.
We did from Humane Society.
Okay.
Let me see. Maybe I can forward you the email right now.
That would be great.
Well, thank you. That's Dr. Carly Bloom. She's an internal medicine specialist from Animal Medical Center. Thank you.